Hi guys, welcome back to my channel. It's Doc Junel and the subject at hand is FAPC. For today's video, we are going to be talking about the anatomy of the heart. If you're ready, then let's start. So first we have to talk about the functions of the heart. We all know that the main function of the heart is to make sure that blood is pumped to all the organs and to all the parts of the body. It will only be able to do that if number one, it is able to generate blood pressure. Why is blood pressure important? Because blood pressure is the force that pushes blood in order for it to reach the different parts of the body, but most importantly, the distal parts or the distal organs of the body. Number two, it routes blood to go to two important circulations. The first is it routes blood to go to the lungs, and we call that pulmonary circulation. And why does blood have to go to the lungs? In order for deoxygenated blood to become oxygenated. And secondly, the heart routes blood in order to get into the systemic circulation. When we talk about systemic circulation, it refers to all the other organs except for the lungs. The heart is able to do this because there are valves found in our heart which ensures the one-way blood flow. And the heart is also able to regulate blood supply because it changes its contraction rate or the speed of its beat and the force of its contraction in order to meet the metabolic needs of the body. So let's say that a person is sitting down watching TV. The heart will not give too much effort because there is no activity that is being done. I mean, there's no strenuous activity being done. But let's say you joined a marathon. Of course, the many muscles in the body, many organs in the body will need additional nutrients. It will need additional oxygen. No, it will need additional blood. So in order for the body to meet the metabolic needs, in order for the heart to meet the metabolic needs of the body, it has to pump faster and it has to pump harder. So those are just an overview of the functions of the heart. Generally, we are looking at the heart here on a lateral view. This is a mid-sagittal or lateral view, no? Let's just orient you. This is anterior, this is posterior, this is inferior, and this is superior. The person is looking towards the left. Okay? So as we can see here, on side view, the heart is actually cone-shaped. It's an inverted pyramid with a base on top and the tip of the pyramid located at the bottom. All right. Each and every person will have a differently sized heart, mainly because the size of our heart is approximately the size of a closed fist, your own closed fist. So if you put out your fist right now and try to examine it, that is the approximate size of your heart inside. If you will look at the position of the heart, it is seated on top of this big muscle over here. And this muscle is actually called diaphragm. For those who are singers or who have gone and done some voice lessons, you've probably heard of the word diaphragm. The diaphragm is an important muscle because it separates the thoracic cavity or the chest cavity from the abdominal cavity. That's why our stomach and our intestines do not get into the chest cavity because we have a boundary. We have a wall, and that is formed by your diaphragm. And the heart sits right on top of that big dome of a muscle. Lastly, in terms of location, the heart is located in a cavity called mediastinum. So this cavity, mediastinum, stretches from your sternum. The sternum is this big bone right in the middle of our chest. I'll be able to show you a picture in the next slide, no? So it starts at the sternum and extends backward until we reach the spine or the vertebral column. And please do know that the mediastinum is the cavity in between the two lungs. So here is a better image which will allow us to better appreciate the mediastinum. Here you go. So again, this big bone right in the middle is your sternum, and at the back of the sternum until you reach the spine, that is your mediastinum. It's right in between the two lungs. Now, in terms of its position, the heart is located, I mean, 2/3 of the heart is located towards the left. This is the left of the patient, no? And this is the right of the patient. And around 1/3 would remain at the right side. Okay? Again, as mentioned, the heart generally has two main parts, no? The base and the apex. The base is the one on top, and the apex is the tip of that pyramid. So here's a better image. Base is the part on top. It's the base of that pyramid, and the apex is the tip of that pyramid if we try to imagine it. Now, if you will notice, the base, no, the top part, is oriented towards the posterior side. It is more superior, and it's leaning towards the right. No? If you will notice, no? Ibig sabihin ng posterior, superior, and right, tignan nyo naman yung position niya. Yung base natin, nakaturo siya towards the back. No? It's also nakaturo towards the right. And then, siya yung superior part compared to your apex. On the other hand, your apex, which is the pointed part, is more anterior. It's very obvious in this picture. It's anterior. It is inferior. And of course, it points towards the left side. So this is just an overview of the position or the location of the heart. Now, why is that important for us, understanding the position of the heart? Because there is such a thing that we call as apical beat or apical heartbeat. Generally, we are able to hear the heart sound loudest at the apex. In Tagalog, pinaka-naririnig natin yung tunog ng puso at the apex. That is why the position of the apex is very important. Why? Because if the position of the apex changes, it tells us that there could be enlargement of the heart, also known as hypertrophy. So, what is the normal position of the apex? As you can see in this image, it is usually located in between the 4th and the 5th space in between the ribs, or as we call it, the intercostal space. It is around the level, gitnang-gitna ng clavicle, called clavicle or collarbone, and we call that the mid-clavicular line. I mean, if you draw a line from the middle of the clavicle downwards, it would fall right on top of the apex. And so, the final position of the apex is 4th to 5th intercostal space, mid-clavicular line. If we try to listen to an enlarged heart, what would we find? We will find that the position of the apex would go lower, around the 5th to 6th intercostal space, and it would go more towards the left. So instead of it being at the middle of the clavicle, it could actually go more towards the axilla or the kilikili, no? Baka mas malapit na siya doon. So if the apical heartbeat, the position of it would go in a different direction, then it could be a sign of heart enlargement, also known as hypertrophy. More of the heart sounds as we go into the physiology. So, just as with any other organ in the body, the heart is also covered by a thin fibrous tissue, and we call that the pericardium. So, as the definition tells us, it is a fibrous connective sac that encloses the heart. Okay? And there are two main layers to our pericardium. The outermost layer of the pericardium that is in contact with your chest wall, yung dumidikit sa chest wall mo, we call that fibrous pericardium. Fibrous pericardium. And that inner layer is called serous pericardium. as you can see here, the fibrous pericardium and the serous pericardium. So the fibrous pericardium is again the outermost layer of the pericardium, and it has two important functions. Number one, it prevents the heart from overstretching. So we know that the heart receives blood, right? And if we have too much blood, let's say, in our body, it is the fibrous pericardium which prevents the heart from overexpanding or from receiving too much blood. Okay? So that's the role of your fibrous pericardium. Secondly, it anchors the heart in the mediastinal cavity, or it makes sure that the heart is placed stably in that cavity. The second layer is the serous pericardium, and as mentioned, it is the innermost layer of the pericardium. Now, the thing is, the serous pericardium is divided into two sub-layers. Those are your visceral and parietal serous pericardium. So, imagine niyo yung inner wall ay nahati sa dalawa. Itong part na ito na nakadikit sa fibrous pericardium at may maiiwan doon na nakadikit kay heart. So yung part na nakadikit kay fibrous pericardium, we call that parietal serous pericardium. And the definition agrees with us. It is the outermost layer of the serous pericardium, and it adheres tightly or nakadikit siya kay fibrous pericardium. While the visceral serous pericardium adheres tightly or nakadikit siya sa heart. And please remember that the visceral serous pericardium is also called the epicardium. So later on, we will go to that, the epicardium. Now, why is it important for us to differentiate yung visceral and parietal serous pericardium? Because in between those two sublayers is a potential space. And that potential space is called the pericardial space. Inside that pericardial space is a buildup of fluid, and the fluid is called pericardial fluid. So the pericardial fluid, which is again located between the parietal and the visceral pericardium, specifically in the pericardial space, is important in decreasing friction. So as mentioned, the heart receives blood. And when the heart receives blood, it has to expand or stretch. So, lalaki siya. And then it has to contract in order to pump the blood outside of the heart. So, liliit siya, no? So, the heart is in a constant, repeated motion of expanding and contracting, expanding and contracting. And in order for the heart to lessen the friction that it builds because of that repeated motion, that is the role of your pericardial fluid, no? It decreases the buildup of that friction. Now, normally, there is only around 50 ml of pericardial fluid found inside the pericardial space. But there is a condition called pericardial effusion. And as the image shows us, pericardial effusion is the buildup of your pericardial fluid, meaning it has gone beyond 50 ml. Now, if there is too much fluid in that space, no, what do you think will its effects be to the heart? Number one, iko-constrict niya yung expansion of the heart, or it will limit the expansion of the heart because the space that should be occupied by the heart when it stretches has already been occupied by the fluid. Secondly, it will compress the vessels of the heart, no? And lastly, if the two first effects will happen, eventually the heart will choke. The heart won't be able to expand anymore. It won't have the ability to receive blood anymore. And if that happens, it leads to what we call heart failure. Now, we mentioned the visceral serous pericardium, and we call it the epicardium. That's important because it forms what we call the walls of the heart. So the epicardium is actually the outermost layer of the heart. if you've noticed, I've already mentioned three outermost, no? First is the outermost layer of the pericardium, and that is your fibrous pericardium. Second, I mentioned the outermost layer of the serous pericardium, and that is your parietal serous pericardium. And the third is this one, the outermost layer of the heart, and that is your epicardium. The second thickest layer is what we call myocardium. From the prefix myo, it would already give us a clue that it is composed of a muscular layer. And the muscular layer of the heart is usually the thickest layer. Alright? And lastly, the innermost layer that comes in contact with the blood is what we call endocardium. Endocardium. So it is a thin inner layer, and it covers the parts of the muscles of our hearts, which we will later on discuss. Now, when we talk about the surface anatomy of the heart, no, before we go into the internal parts of the heart, let's first discuss the outer part. No, when we study the surface anatomy, we have to understand the three surfaces of the heart. I mean, there are three surfaces to the heart. First is the anterior surface. This is how the anterior surface would look like. So basically, when we open up the chest of the patient and we remove the sternum and we remove the ribs, the way that we will see the heart is what we call the anterior surface. So it is also called sternocostal surface because the anterior aspect is in communication or is attached or nakadikit siya sa sternum and sa ating ribs. So sternocostal surface. And the first two parts of the heart which will greet you when you open the heart are the right atrium, this one, and the right ventricle. Now, we highlighted the right ventricle as blue because the right ventricle is the most anterior portion of the heart. Siya yung pinakaunahan. The right ventricle is the most anterior portion of the heart. Now, if we look at the heart from a posterior surface, mula naman sa likod, no, you will notice that it is comprised by most of the structures found at the base. Because remember, when we talk about the base, the orientation of the base is posterior, superior, and towards the right, if you still remember. Now, the two most obvious parts of the heart here are the right atrium, this one, and the left atrium. Basically, yung mga atrium natin. And we highlighted the left atrium because the left atrium is the most posterior portion of the heart. And lastly, we have the inferior surface. Okay? The inferior surface is the one at the bottom. It is in communication or it is attached to your diaphragm. That's why it's called the diaphragmatic surface. And the two important parts of the heart that are found in the inferior surface are your right ventricle and your left ventricle. And we highlighted the left ventricle because it is the most inferior portion of the heart. The most inferior portion of the heart. Now let's go to the inside of the heart. The way I explain the heart structure to my patients, I always make them imagine a house. No? Imagine a house that has 2 rooms on top and 2 rooms at the bottom. Basically, that's the composition of the house. No? When you open the door, you'll see a staircase leading up to 2 rooms on top and 2 rooms at the bottom floor. And the 2 rooms on top are what we call atria. In singular, atrium. The atria are important because they are the receiving chambers, meaning this is where we receive blood. Okay? This is where we receive blood. The right atrium receives deoxygenated blood, while your left atrium receives oxygenated blood. So if the right atrium receives deoxygenated blood, then where did the blood come from? It came from your veins. Alright? And there are 2 important veins shown in this image which opens up into your right atrium. First is your superior vena cava, which brings blood back to the heart coming from the upper half of the body. So the superior vena cava or SVC brings back blood to the heart, or specifically to the right atrium, and this blood came from the upper half of the body. While the inferior vena cava, this blue structure here at the bottom, brings back blood to the right atrium, and the blood came from the lower half of the body. On the other hand, the left atrium receives blood naman from your lungs. So it receives blood and it's brought by these 4 vessels that I'm pointing out to you right now. Those are your pulmonary veins. Your pulmonary veins. They bring back blood to the left atrium, specifically oxygenated blood. Now, if you will notice, the walls of the atria are actually very thin, and they are composed of what we call as pectinate muscles. Pectinate muscles. So please do remember that. What do we call the cardiac muscle found in the atrium? We call it pectinate muscles. And in between the two atria, in between your left and your right atrium is a wall. And we call that wall meaning between, atrial septum. Interatrial septum, or the wall in between the two atria. Okay, so there is a wall called interatrial septum. And in adults, you will find an oval depression inside or in between that interatrial wall. This is because when we were born, there used to be a hole found in the interatrial wall. And this hole was called foramen ovale. Okay? The wall found in the interatrial septum is called foramen ovale. But when we are born, or a few moments right after we get out of the womb, this foramen ovale will normally close. It should normally close. And when it closes, it will leave a depression, kumbaga a remnant of that foramen ovale, and we call that fossa ovalis. So just to run it down again, foramen ovale is that normal opening or that normal hole in between the interatrial septum. And when we become adults or right after birth, it should already close, eventually leaving an oval depression called fossa ovalis. That is why in some patients, that hole never gets to close. No, may mga pasyente na yung foramen ovale nila will not close. That's why I'm sure you've heard in the news, or maybe you have relatives or friends who've told you that they have a hole in their heart. This is what they mean when they say that. Now, after blood reaches your atria, both left and the right, no, it will go into the next chamber. These chambers here at the bottom, and we call them ventricles. If the atria is the receiving chamber, then the ventricles are the pumping chamber. They are the pumping chamber. So, since they are the pumping chamber, it would require that they have thicker muscles. Kailangan makapal yung muscles dyan in order to create, again, the force to drive blood forward, no? So, we call that muscle trabeculae carneae. So, the muscle of the ventricles are called trabeculae carneae. Ito sila, guys. It appears like a ridge appearance, no? Parang butas-butas appearance ng muscle. That's your trabeculae carneae. Now, if you will notice in your trabeculae carneae or in your ventricular muscle, there are some muscle which are actually elevated, nakaangat, like this 4 over here, no? We have 2 on this side and then another 2 on this side. We call those elevated muscles as papillary muscles. Papillary muscles. Now, they are cone-shaped structure found in your trabeculae carneae, and they are important because this is where the chordae tendineae are attached. Ano yung chordae tendineae? Yung parang web-like structure na yan, no? Going upwards. Diyan naka-attach yung mga web-like structure na yan. And later on, when we discuss the valves, you will understand the importance of this of this chordae tendineae. In layman's term, they call chordae tendineae as heartstrings. Okay? So, just an additional information. And similar to your atria, ang ating ventricles, they also have a wall separating the two of them, and we call that interventricular septum. I think this image is a little bit better. This is your right ventricle, which receives deoxygenated blood, and this is your left ventricle, which receives oxygenated blood coming from your left atrium. Okay? So as mentioned, they are separated by a wall called interventricular septum, and the muscles in this chambers are generally thicker compared to the two chambers that you find on top. That is because they have to generate enough force to pump or to push blood towards the next part. Now, it is important for us to know that there is a difference between your right ventricle and your left ventricle. So, your right ventricle has generally thinner walls. Mas manipis yung walls ng right compared to the left. Okay? Pansin nyo ba? Ito yung left natin, very thick. Yung mga muscles na nakikita natin sa walls ng heart compared to the right. And since the right has lesser muscles, it has thinner muscles, it will only create a fairly low pressure. Okay? Low pressure lang din yung makikreate niya. On the other hand, your left ventricle, since it is composed of thicker muscles, will be able to create higher pressure. Now, why is there a need for a pressure difference between the two ventricles? This is because of where they will bring the blood. So, the right ventricle will pump the blood towards the pulmonary circulation. So that the oxygenated blood from your right ventricle will be brought to the lungs for oxygenation. And it has to pass through this big vessel here, itong color blue, and we call that the pulmonary trunk. And then it will separate into the pulmonary arteries. On the other hand, your left ventricle naman, it has to have high pressure. It has to be very effective in pumping blood out of the heart because it brings blood to the systemic circulation, or generally all the parts of the body except the lungs. Kaya mas kailangan niya mag-work harder to maintain the same rate of blood flow. Now, if you will get the pressure in between the two ventricles, you would find that the average pressure in the right ventricle is only at 4 to 25 millimeters mercury, in comparison to your left ventricle, which has 70 to 130 millimeters mercury. So next, let's talk about the valves of the heart. In order to keep blood in a certain area of the heart, there are valves that keep them in place. So when the valves are open, as seen in this image, so if the valves are open as seen in this image, blood can flow through from the atrium to the ventricle, or from the ventricle to the vessel, wherever they are located. Blood can flow through. But when they are closed, blood cannot flow through, and blood cannot flow backwards from where it came from. That's how important these valves are. That's why the valves keep the heart in one direction, or keep the blood flow rather in one direction. And there are two main types of valves in the heart. The first is your atrioventricular valves, or AV valves, and it's quite obvious, where they are located. They are right between the atrium and the ventricle. And the second is your semilunar valves, which are also known as your outlet valves, because these are the valves that the blood has to overcome or has to pass through before they go to the pulmonic and the systemic circulation. So, unahin natin yung AV or atrioventricular valves. As mentioned, they are also known as inlet valves because basically dito pumapasok yung blood natin from atrium papunta ng ventricles. So, each side of the heart will have one AV valve. On the right side, we call it tricuspid valve. And on the left side, it's called bicuspid or mitral valve. So, ang ginagawa ng AV valves natin, again, they open and close to allow the passage of blood from atrium to the ventricle. And nagsasara rin sila in order to prevent blood from flowing through. That's one. And the second, in order to prevent blood from going back to the atria. Alright? So, the next type of valves are your semilunar or outlet valves. They are small, but they are strong. Okay? They are small, but they are strong valves. So, if this is your tricuspid and this is your bicuspid or mitral valve, ito yung semilunar valve natin. Yung dito sa atrium, hindi natin masyado, sorry, sa aorta, hindi natin masyado ma-appreciate. Natakpan siya ng pulmonic natin. So, dalawa rin yung ating semilunar valves. On the right, you have your pulmonic valve kasi yung blood from the right ventricle, pupunta yan ng pulmonary trunk bago pumunta ng pulmonary artery. Kaya siya, that's why we call it pulmonic valve. On the other hand, we have the aortic valve, which is connected to your left ventricle. It's called aortic valve because after the left ventricle, it will now go to your aorta para pumunta siya sa systemic circulation. Now, if you are quite curious why we call it tricuspid and bicuspid, this is because of the arrangement of the valves. As you can see here, this is a top view. As you can see here, this is the tricuspid valve and it's composed of 3 cusps. 1, 2, 3. Okay, 1, 2, 3. Tatlo sila, kaya tricuspid valve. On the left side, you have your bicuspid or mitral valve, and dalawa lang siya, no? Dalawa lang yung cusps. So that's why it's called bicuspid valve. Your semilunar valves look similar, no? They are cup-like. They are small, light, and cup-like structures, but they are strong. All right? Now, when we talk about the heart chambers, nabanggit ko kanina, there is a difference in terms of the left and the right side. As mentioned, the left side is more muscular compared to the right side. Thus, the left side creates more pressure. No, there is a greater contraction, greater force created by your left side. Also, the function of the valves, I've also mentioned it. They prevent backflow of blood, no? Specifically, your AV valve, prevent backflow of blood from the ventricles, hindi pwedeng bumalik ng atria. And your semilunar valves also prevent backflow of blood, hindi pwedeng bumalik kay ventricles after na niyang pumunta kay pulmonary trunk or kay aorta. So, these valves actually, may iba pang mga valves found in our heart and we call them rudimentary valves. Why rudimentary? Kasi wala silang function. They are found there during our fetal development but eventually nawawala din sila. So, we have 2. The first one is the Eustachian valve. In terms of position, ito po siya. This is your Eustachian valve. So, nakikita siya doon sa opening ng ating IVC or inferior vena cava. Doon siya sa opening ng inferior vena cava. But ultimately, wala siyang function. Yang Eustachian valve natin. Next, your thespian valve. So, oh, by the way, if you're curious, the superior vena cava has no valve. So, wala siyang counterpart. Next is your thespian valve. It is also rudimentary and non-functioning. And this is the one. Ito siyang thespian valve. So, it is the opening or it is the valve found in the opening of the coronary sinus. So, ano ba yung coronary sinus? Later on, pupuntahan natin siya. But it is the opening ng heart natin para makabalik yung blood from your coronary veins. Okay? From your coronary veins. Later, I will discuss more of that as we go along. So let's now talk about the major vessels of the heart. I've already mentioned a few. First, I already mentioned the superior vena cava. It brings deoxygenated blood. Kaya nga siya color blue eh. Basically, yung mga color blue structures, puro deoxygenated blood yung laman. And yung mga red structures natin, they receive oxygenated blood. So the superior vena cava brings back blood to the heart coming from the upper half of the body. And then, it goes to your right atrium. On the other hand, you have the pulmonary trunk. Ito naman yung pinupuntahan ng blood from the right ventricle. and it will deliver blood away from the heart, papunta naman ng lungs. And the last major vessel that we see here is the aortic arc or aortic arch. Ito naman, it is connected to your left ventricle, and it delivers blood away from the heart and towards the systemic circulation. So here is a summary of everything I mentioned. Okay? So the pulmonary trunk, it brings the oxygenated blood so that it can bring it to the lungs for it to be oxygenated. And then, after kay heart, ibabalik niya yung blood papunta kay left atrium through the left and the right pulmonary artery. So later on, we'll show you the pulmonary arteries. There you go. So, if you still remember, ito yung sinasabi kong division ng pulmonary trunk natin. You have your left pulmonary artery and your right pulmonary artery. So generally guys, when we say artery, they deliver blood away from the heart. Artery, letter A, artery, away from the heart. So yun yung ginagawa. So away from the heart, and they bring blood to the lungs for it to be oxygenated. Kapag may oxygen na si blood is brought back to the heart through the left and the right pulmonary veins. So ang veins in general, they bring back blood. I purposely did that para matandaan natin na veins bring back blood to the heart, specifically sa left atrium natin. And now in this posterior view, we're able to appreciate the inferior vena cava. Ano ulit yung rudimentary valve ng inferior vena cava natin? The Eustachian valve. So here is a summary of the definitions I told you. So now that we know and understand the valves of the heart, let us now go to the auscultation of the valves. So ang heart sounds kasi natin guys, or the lub-dub na narinig natin in our heart, it is created by the opening and the closing of our heart valves. The opening and closing of your AV and semilunar valves. Okay? So if you will notice in this image, we already highlighted where they are originally located. So, yung sound na pinoproduce ng mga valves natin, they are not heard where they are located. They are heard best in a different position. So, let's start with the aortic valve. So, kung dito located yung aortic valve natin, the sound created by the opening and the closing of your aortic valve is best heard here. And what is this position? This is the second intercostal space on the parasternal line. Ibig sabihin ng parasternal, right beside the sternum. Ito yung sternum mo, di ba? This bone right here. So right beside the sternum and on the right. That's why here the location is right second intercostal space, parasternal line. Diyan mo maririnig ang opening and closing ng aortic valve mo. On the other hand, when you want to hear the pulmonary valve, then you should hear it best at the left second intercostal space, parasternal line. Okay? Ito kasi yung second space eh. This is the first intercostal space. Sorry. This is the first intercostal space. This is the second intercostal space. So, dyan siya sa second. Katabing-katabi ng sternum. So, second intercostal space, parasternal line. If you want to hear the tricuspid valve, it is best heard here naman on the fourth intercostal space, left parasternal line. Okay? Sa left ulit, and then on the parasternal line. And if you want to hear the mitral valve, you'll hear it best at the apex. Or remember, I said earlier, we have to look for the apical heartbeat. And what is the location of the apical heartbeat? On the left, fifth intercostal space, mid-clavicular line. Earlier, yung description na binigay ko was based on the ribs, di ba? Fourth and fifth rib space on the left midclavicular line. Now, ang ginamit na natin is the space. Kaya siya fifth intercostal space, midclavicular line. So here is a table showing the location of the valves, yung original location nila, and where the sounds are best heard. So please remember this. So generally, there are two heart sounds that can be heard in the heart. Regardless kung pinapakinggan mo ay aortic, pulmonic, tricuspid o mitral, maririnig mo generally itong two heart sounds na to. The first and the second heart sound. So the first heart sound is created by the closure of your AV valves. What are your AV valves? The closure of your tricuspid and your mitral valve. So pag nagsara yung dalawang yon, then you will hear the first heart sound. The first heart sound is described as low in pitch, mababa daw yung tunog, and it's longer, no, longer lasting yung first heart sound. So, yung first heart sound is also described as lub. 'Di ba yung heart sound daw natin ay lub-dub, lub-dub, lub-dub. So the first heart sound is low in pitch and relatively long lasting. While the second heart sound naman is created by the closure of your aortic and pulmonary valves, or generally your semilunar valves. And usually you'll be able to hear it at the end of systole, or pag atapos na yung ventricular contraction. You will hear a rapid snap and it will be followed by a vibration which causes the second heart sound. So as mentioned, S1 or the first heart sound is described as lub due to the closure of your AV valves. It's louder, low pitch, and it lasts longer. While your S2 is described as your dub, closure of your semilunar valves, it's shorter, and it's not as loud as your S1. And there are other heart sounds which can be heard, especially when the heart has a pathologic condition or pag merong disease yung heart natin. So these are S3 and S4. S3 is heard due to the rapid filling of the ventricle. Forgive me for that. And it usually happens due to a congestive heart failure, a disease called congestive heart failure. S3 is also called as ventricular gallop. Okay? While your S4 is also called atrial gallop, and you'll be able to hear it in conditions such as myocardial infarction or heart attack and hypertension. So now we'll go to the blood flow inside the heart. So this is very important because this is the main purpose of the heart, right? Circulation. So let's try to understand what the direction of the blood flow is. So blood flow will start, of course, with the delivery of blood by your superior and inferior vena cava to the right atrium. After blood has been collected in the right atrium, it will then have to open the tricuspid valve, after which blood will be able to enter the right ventricle. Once enough blood has entered the right ventricle, and enough pressure has been built, it will then cause the pulmonary semilunar valve to open, thus delivering blood to the pulmonary trunk. Ito yung pulmonary trunk natin. After the pulmonary trunk, blood will then go to the pulmonary arteries and eventually go to the lungs to complete the pulmonary circulation. After blood has been oxygenated, blood has to return to the heart via the pulmonary veins. And then, it will then be collected or received by your left atrium. Once enough blood has been collected in your left atrium, it will open the bicuspid or mitral valve, causing blood to enter the left ventricle. Once enough pressure and enough amount of blood has been collected, it will open your aortic semilunar valve, causing blood to be pumped into the aorta. After it goes to the aorta, there can be two pathways. First, it will be brought to the rest of the body tissues in order for systemic circulation to happen. And then, after the tissues has already consumed the oxygen in the blood, it will then be again collected by your superior and inferior vena cava. That's the first pathway. The second pathway is for the blood to enter the coronary arteries. Later, I will discuss what the coronary arteries are for. After which, blood will go to the heart tissue for what we call coronary circulation. Then blood will be collected by your coronary sinus and cardiac veins. And then it will be brought to your right atrium. Okay? So that's the entire blood flow. You have to memorize this by heart and understand the flow. It will be also best if you will look for YouTube videos in order for you to visualize that blood flow. As mentioned, there are two circuits where blood is being pumped into. First is the pulmonary circuit or pulmonary circulation, whereby blood is delivered to and from the lungs in order for blood to be oxygenated. The second is systemic circuit or systemic circulation, which is the delivery of blood to the rest of the body in order for the tissues to consume oxygen and also to expel carbon dioxide. So as mentioned, arteries carry blood away from the heart, while your veins brings back blood to the heart. And the oxygen exchange, the gas exchange happens in your capillaries. This is where the gas exchange happens. So by this time, we've already established that the right heart pumps blood to the lungs and the left heart pumps blood to the rest of the body. And this is accomplished by your two-chamber pump, the coordination of your atrium and your ventricle. As mentioned earlier, the muscles forming your atrium, and what do we call those muscles again? Your pectinate muscles, is a weak primer pump. So, yes, meron silang muscle, and yes, capable sila of pumping, pero it's weak. And the only goal of the contraction of the atrium is to move blood into the ventricle. The ventricle naman supplies the main pumping force. That's why the trabeculae carneae muscle is very thick, especially in the left atrium, because it needs to propel blood either to the lungs from the right ventricle or to the rest of the circulation from the left ventricle. So how is blood ejection made? So first, let's start with the right ventricle. This is your right ventricle. Okay? So the first movement of blood ejection is the movement of the base. The base is the top part towards the apex. So magsho-shorten yung length ng muscle natin. Second is the movement of the free wall. Yung free wall, yung lateral wall, no? Movement of the free wall towards the interventricular septum because of the spiral contraction of the heart muscles. Later on, once we go to the physiology, you will see yung spiral arrangement ng muscles in the heart. And lastly, there is an increase in the curvature of the septum. This is your interventricular septum. Mas magiging curved pa siya para mas ma-eject nila yung blood. And we call this left ventricular aid. In the left ventricle, ejection is made, number one, by the movement of the base towards the apex. So, similar lang kanina. And ito yung unique sa kanya, the shortening of your constrictor fibers. So, as mentioned, di ba, thicker muscles are found in the left ventricle. So, how are they able to contract? Magsho-shorten yung constrictor fibers mo para lumiit yung space sa loob at lumabas yung blood natin. So, as mentioned, the pathway, another pathway where blood goes to after going to the aorta is to your coronary arteries. To be honest, this was one of the few things that I did not understand before. Akala ko yung blood na pumapasok sa heart, yun na rin yung nagpo-provide ng nourishment, ng oxygen sa heart mismo. Pero hindi pala. Yung ating myocardium, the muscle layer of our heart, also has a blood supply. Meron din siyang sariling blood supply para magawa ng heart yung pumping niya or masupplyan siya ng oxygen and nutrients. And ang gumagawa nun, nagsusupply ng blood sa heart natin, is your coronary arteries. So ito sila. Bakit sila related to your aorta? Because your coronary arteries arise from your aorta. So pagdating ng blood kay aorta, may mga blood na rin that will go to your coronary arteries. So they will supply blood to the muscles of the heart. There are two divisions of the coronary artery. First is the right coronary artery and the left coronary artery. So the right coronary artery is able to supply to the right atrium, the right ventricle. Tapos iikot siya towards the posterior side to provide blood to some parts of the left ventricle and also to your SA node. So later we will go to this SA node once we get to the circuitry of the heart. The left coronary artery will have two branches. The first is the left anterior descending coronary artery. Tinatawag din niya na LAD, left anterior descending. The left anterior descending artery will give its supply to the left atrium, more importantly, the left ventricle, and some parts of the right ventricle. And then yung isang part pa niya is called circumflex coronary artery, which will go to the posterior side. So as mentioned, there are branches, no? First is your LAD or LADA. It supplies the anterior wall and the apical wall. Apical wall, sabihin, left ventricle. The circumflex artery will go to the posterior side to supply yung lateral and inferior wall of the heart. In terms of bringing back blood to the heart, it will then be performed by what we call the coronary sinus. So kung naaalala ninyo kanina, when we talked about the right atrium, I mentioned the coronary sinus, di ba? It has a valve, remember? The thespian valve. So the coronary sinus is an opening to the right atrium and it brings back blood to the right atrium coming from your coronary circulation. There are three veins which performs the bringing back of blood towards the coronary sinus. The first is your great cardiac vein. Ito po yan, yung malaking ito. And the great cardiac vein, usually, it runs parallel to your left anterior descending artery. Magkatabi sila, nilada. So it drains the interventricular septum. It drains the anterior portion of both the left and the right ventricle. So sa anterior, yung great cardiac vein natin. Si lesser cardiac vein will go naman towards the direction of the right coronary artery. So it will drain the marginal area and the right ventricle. Si medial cardiac vein naman, si middle cardiac vein, it will go and run parallel to your circumflex. Okay? So kasama naman niya si circumflex artery. It also drains the interventricular septum and the posterior portion of your right and your left ventricle. So that's it for our cardiovascular anatomy. In the next video, we will be talking about cardiovascular physiology. So I hope you learned something. Kindly review the video again for better memorization and better retention of information. God bless.